every patient is different, and you cannot just have it one cookie cutter just for everything. It has to be customized.
Hi, I'm Natasha Gillis, and here's a little secret. One of my favorite things to do is drive around town and proudly point out each dental practice my firm has helped grow. Because behind every practice is a real story of grit, vision, and entrepreneurship. On this podcast, you'll hear those real stories straight from the dentists who dared to build something of their own. So tune in, get inspired, and remember, your practice is my passion. I am here today with Dr. Attia with Alexandria Center of Dentistry. Hi, Dr. Attia.
Hello again. How you doing?
It's so good to see you again.
I'm so proud to be here again.
I feel like I just saw you a few months ago, but we did. I saw you in October. That's right.
Yeah.
So it wasn't that long ago.
It was great. It was a great meeting.
It was great. And you've become a prominent speaker in the past several months.
I'm enjoying it. I love teaching. I love lecturing. I love sharing experience with new dentists. It's really a passion for me, a new passion, I would say.
So remind me your background and how, because I want to talk about more of your lecture passion, but you did general dentistry and then you niched. So go ahead. I'm going to let you fill me in a little bit.
So I've been practicing dentistry for 23 years now. Mm-hmm. Dentistry is my passion. I'm very lucky because I did not expect to love dentistry that much when I actually joined dental school. It was interesting for me. I knew I want to do it, but I was not sure how it's going to be. I'm very lucky because it's a passion. Mm-hmm. I love general dentistry. I enjoy treating my patient. I love implants. It's just like the most I enjoy. But I enjoy taking my patient from the beginning, first visit, treatment plans the patient, able to provide them with everything under one roof because we do everything at my practice. So basically, I feel like I take them from start to finish and then maintenance, and patient is good. I enjoy it.
That's phenomenal. And in order to be good, you really have to enjoy what you do.
It's a must.
Yeah.
It's a must. As they say, love what you do till you do what you love. I was so lucky. From the beginning, I'm just doing what I really enjoy.
So now you lecture on implant dentistry. When did you decide this is your passion specifically to do implants and then learn about it to the point that you can lecture about it?
Actually, right after I graduated, I started learning about implants. I really enjoyed it. I really loved it. It just had the drive. I want to learn more. I want to know more. I want to do more procedure and do different things. So it's been a passion for me since graduation. But after that, it's funny because I always tell a friend of mine that's been lecturing for a longer time, I just don't know what I'm gonna say. Everybody knows this stuff.
Yeah.
Like, I'm not adding something new. But what I found out, no, there's a lot of people who need this experience. A lot of people don't know, okay, how to do that, or what is your flow, or what you do, or how to use best. I was surprised.
Yes.
At the same time, I can actually share this stuff. I can help people. So I'm like, all right. So I started, I would say, late than what I should have, but
never
I'm happy.
too late.
I'm happy that I'm doing it now.
Good for you.
Yeah.
So, this is something interesting that I'm seeing a lot of is doctors who are realizing I have something to share. I don't just need to spend my time sharing it with the patients behind the chair, but I can share it with colleagues. I can educate the community. So I am seeing a shift with a lot of docs going into speaking. When did you decide that this is really going to be your professional passion, not just kind of a fun thing, but something that you're pursuing more seriously?
I was invited for one of the meetings, and it was only like 20 minutes talk. And I'm like, okay, let me do that. And I had some interesting cases to share. So I went in there and started talking and share it. The feedback, what was really surprising for me, everybody came, oh my God, thank you so much for sharing this with me. That's really going to help me a lot. I'm like, that's when I realized, so actually not everybody knows this stuff. I can actually share and help people with it. That was a turning point for me.
Do you find that when you go to lectures, sometimes it's not the content, but the way that it's delivered between one speaker and another that can make the difference for you?
That's why I love live meeting more than webinar. Webinar is so like, I don't know, you don't see who you're talking to. Body language make a difference. And also you don't know if the receiving person is paying attention or if they interested. I love being in the meeting because I can see you. I can see, oh, that's interesting for you. I can give you more information. I can go and elaborate. But sometimes with webinars, it's important. A lot of people love do it online on their couch and
Yes,
comfortable.
it's comfortable.
But it just as a feedback is important for me to know, okay, where are you and how you're receiving this information.
That's very true.
Yeah.
So, I was teasing you earlier. I said we have Team Tesla and Team V8 in the same room. So let's fight about this. Let's talk about this. Something that, in terms of Teslas and that sort of conversation, AI. How do you feel that AI is essentially commanding a presence in dentistry? And then let's talk about, if it's helped you with your speaking. I mean, that's kind of two sides of a different coin.
Well, I love Tesla, so I can now go. But AI is amazing in everything, and it's growing a lot. But AI in medical field, it's been there for a while. Nobody realized that, but it's been there for a long time. With patient scheduling, text message you get all the time whenever you go to confirm your appointment with your dentist or with your physician. Feedback, oh, please leave us a review. All these stuff are automated.
Correct.
And it's been going for a long time. And also nowadays a lot with patient scheduling online. You can go and book your appointments. With the chat, you go like on their website and you get a response back. And all that is great. And it's a great tool. And it did replace some human job, I can tell you that.
Yeah.
But can it take it all away from the administration perspective? I cannot see that happening completely. No.
I agree.
Because what happened when you call your airline and having a problem? You get the automated message and automated reply, right?
And you scream at
But
it,
then,
help,
representative,
person.
live person, I need
Yes.
to talk to somebody.
That's right.
It's so frustrating sometimes because when you really need help, now it's talking about human expertise and customization because it is not going to be robotic anymore. I need help. Hey, I have a problem. I need that taken care of.
100%.
So yeah, human factor is still very important, but AI is a great tool in our toolbox to make life easy for business owner and for customers too, to a certain extent.
But we were talking about this, the use of AI to educate patients. So away from the administration and more towards the practice.
So now talking about the back. So the back side, a lot of stuff. First is patient education. There's a lot of softwares that now can show the patient where the decay is. Like it basically takes the x-ray and on the x-rays, it already can read where is decay, where is like bone loss, where is everything. And it's different colors. So patient can actually see it. It's a very good educational tool. Can it be done without AI? Yes, it can be done, but it's going to take time from the dentist to color everything and put it there. It's all about saving time.
True.
So now there is multiple softwares to elaborate the stuff on x-ray. So patient can see it. Oh, I have a problem with these tooth. When patients see it, they understand, oh, that's why I need a filling. Oh, that's why I need a root canal. Or, oh, I have a big infection. So all that is good. But all these programs are programmed with the human.
True.
So it's all, we feed this information to them. So there is an error factor because not every patient is the same. So there is still room for errors. That's why human expertise is still very essential to make sure it's right and change it as per patient if needed. So that's for x-rays. The other one is 3D imaging, scanning all the patient. Even with CAT scan, nowadays CAT scan can read where is the nerve and where is the sinus and where is everything. So it's amazing. It's really good. So I love technology. So in my office, we do have like the CAT scan. And then we have the 3D scanner. I have actually 3. I don't know why, but dentists are crazy a little bit with technology.
It's like
we
equipment.
Just like to,
Yes.
It's toys for us. We just, okay, I need that. It's great. It's so cool. So we get the CAT scan for the patient. We get a 3D scan for the patient teeth. And then we use a software to merge them both together, the CAT scan and the 3D. So now both images are together, and we can use that to design a night guard, or we design a surgical guide. If I'm placing an implant, I can design the guide at my office to know where to place the implant exactly. Just make my life easier, and just use a guide, place the implant, I'm done. It's gonna make the surgery, instead of like, I don't know, 45 minutes, gonna make it like 10-15 minutes.
Incredible.
So it's better for the patient too, because the patient will be in and out like that.
Yeah.
And I can use all this information to do whatever I need to do. So surgical guide, I can actually print it in my office.
That's what I was going to ask you. Yes.
I can use this information, I can design it, and then I print it in my office, which is very convenient.
That's incredible.
I have it within few minutes, and then I can do the surgery right away. It's a lot of help. As I said, it's a great toolbox. It saves time for the patient. It saves time for the provider. Again, I think human expertise is essential to do all that and make sure it's done right, but it's a great tool to have.
You know, sometimes I follow these trends on social media, and I saw, I guess, you know, I don't know if it's real, if it was AI projected video, but they showed this robot and how the concern was it could take over hygiene. Do you think we're ever going to, realistically, I'm sure maybe in the future, but in the immediate future, are we going to get to a point where we have actual AI working on a patient, do you
Actually,
think?
right now there is a robot to place implant, 100%. Okay, so basically how it's done is you go in there, you do the treatment plan, I see the missing tooth here, I design it on the software, I feed it to the machine, and the machine go ahead and place the implant right there. You still have to hold the handpiece for legality reason, because if something goes wrong, it's not the machine, it's you. Okay, but it 100% places the implant where you planned it. That's why I'm still saying it's great, but guess what? It's a tool. Needs a human expertise to make sure I design it correctly, I place it there, and I'm monitoring everything just to kind of make sure it's done right. Eventually, will that change? Will that just be 100%? I think in the medical field might be a little bit hard to eliminate the human factor completely, because every patient is different, and you cannot just have it one cookie cutter just for everything. It's just, it has to be customized, and it has to be like, okay, for that patient, I need certain, I don't know, different technique or whatever. So it's growing, it's definitely changing everything, but human factor is really important to be there.
Do you find that you can utilize AI in your lecture circuit? Has that helped you in any way, or are you just explaining how to use it again as a tool for dentists?
Of course. AI, even AI generated like ads.
Oh, yeah.
You see it, how cool and how different it is. It just add a different, I don't know, life into things. So yeah, it definitely was lecturing and stuff. It's going to make a huge, more interesting lectures, I would say.
That's true.
Yeah.
I mean, we were talking about, Chat GPT and all these kind of fun tools for presentations. You can use it for presentations. But aside from that, when you're lecturing about use of AI as a tool, have you ever talked about potential risk and malpractice implications?
Of course, because patient informations, transforming patient data to different areas, all that have a risk. So I think you can help us with that too. You can tell us, I don't know what is the background of all this stuff, how we're going to change.
Right.
Because I think it's a little bit more vulnerable to, I don't know, all these data to be out there.
I think so too.
But
Yeah. Well, you're right. AI can be used on the management component. It can be used on the clinical component. You have multifacets in an office. But on the management side, when you're taking patient information, you're getting that, as you said, data breaches. I mean, these are also becoming threats that we have to be aware of. And then the question becomes, at what point, too, am I breaching? Like if you're taking notes, and, we were talking about in the medical field with SOAP notes, if you're taking these notes and you're dictating it, are you giving permissions to that software to take that data and do something else with it? That's another concern, is that fine print.
Yeah.
And most people either don't have the competency, not in a mean way, but a lot of it's just all legalese. They don't have the competency to read through these, or otherwise they don't have the desire. I mean, it's a lot of stuff.
We all kind of naive, and we would like to use okay, it's a great technology, I want to use it, stuff. Nobody reads the fine prints in there, but it's like, honestly, it should all be for the good reason. We're using it to help the patient save time and all the stuff. We're not expecting to run through problems. We're not expecting, like, risks around that.
So I guess the other thing too is for the doctors who are concerned for whatever reason that Dr. Robot's going to take their place. We always talk about, as a professional, there's multiple ways to secure your income. And one of those is, for example, lecturing. What is your thought for young dentists, or even dentists who have been doing dentistry, in terms of securing other sources of interest or income? Do you think that can be a potentially beneficial way to grow your practice?
I think it's really important to have other incomes than your main job. I realized that in COVID. Like when COVID happened and we had to sit home for 2 months and we didn't have anything else to do, I'm like, okay, this is not good. Problem with dentistry, you have to be there. As a single, like, private office dentist, you have to be there. If you're not there, there's no work, right? Other modalities is some people take dentistry as business, which is, it's great for them because maybe that should be the way. You have multiple practices and you're just hiring like a different dentist to take care of each office, and you're just managing it, but not for everyone. For me, I'm very picky with my details. I like everything to be perfect. I like to monitor everything and do it with my hand. It's a craft. For me, it's a craft. I have to do it. So for me, it is not a good business modality. Why? 'Cause I have to be there. I have to do everything. I enjoy it. I love it. It's not for everybody. And just for me, I have to make sure it's perfect. I have to be there and do it and make sure everything is good.
Yes.
Lecturing, it is not a money maker. It is not like you would make way better income working at your office than lecturing, but it's a passion. It's you changing people. I don't know. It's like teaching. You're changing people's life. You're making someone life much better, and their patient too, because you're going to take this experience and share it and use it for their patient. Of course, it's good to have more than one source, but it cannot replace your work at your office. I think it would be better for dentists to have a side project or a different business on the side that, generating income for them. But other than that, I think dentistry is great. Again, it all depends on the clinician.
Yeah.
It all depends on the clinician.
It just sounds like, for a young dentist, for instance, who's listening, you really have to have passion in this industry in order to survive, in order to thrive.
Especially dentistry, you have to have a passion in it, because it is not easy job. My back hurt, my neck hurt, you're studying all the time, you're learning new technique all the time. If you don't have the passion in it, it will be a very tiring job. It will be a very exhausting job. I don't see it without a passion. And it happened actually. I've seen some of my friends, they go through dental school, graduate, and then they find out they don't like dentistry.
Yeah.
They never continue.
Yeah.
They leave the field and go do something else, which I totally understand, because it's a very hard job. Yeah. It takes a lot of dedication, a lot of work. It's very tiring, very detail oriented. You're talking about like less than millimeter accuracy. You want to make sure the margin is sealed. Yeah, no. It requires dedication. And I believe that's for the medical field too. Maybe not as much as dentistry.
Depends.
Yeah,
Surgeons,
it depends.
Yes.
Oh, surgeon for sure.
Yes.
But other field, maybe not much, but I don't know.
Yeah.
Dentistry, I can tell you, you have to love what you do.
By far,
succeed.
my dentists, if there is a management of the format, because sometimes it happens with email. Oh, the formatting is off on the document. So,
By the way, most dentists are very detail oriented.
Yes.
They like everything to be perfect. They like, that to be just leveled. And yeah,
yes, I've
we are the worst customers for anything. I can tell you that.
No,
It's like,
absolutely not. That's
yeah,
not
we're
true.
like, okay, I want everything to be just perfect.
So last question, Cybertruck or normal pickup truck?
Cybertruck is ugly. If they just redesign it, I would love it. But it's designed for me, I don't know. Some people love it. They're like, oh my God, this Cyber is so cool. For me, I'm not a big fan. But
So would
hopefully
you drive a traditional pickup truck over your Tesla if you had to pick electric Cyber or normal truck?
Normal
I'm trying to
truck
get
for
you
now.
back in.
Normal truck for now, but yeah.
Oh, well, thank you, Dr. Attia, for being here today. I appreciate
Thank
your
you so
time.
much. Thank you so much. I love being here. I love, cheering and talking, and that's been a pleasure every single time.
Thank you so much.
Thank you so much.
If you enjoyed today's episode, be sure to follow and share this podcast with a friend in dentistry. And if you're ready to take the next step in your own entrepreneurial journey, connect with me. I'd love to make your vision a reality. Until next time, keep building, keep growing, and keep practicing your passion.